behalf of myself and the Department of Obstetrics and Gynecology at Washington University, I want to thank you all for coming to visit us and seeing us on our interview day. I know this is a very busy couple of months for you all, and so we really appreciate the time that you've taken to come and visit us. We've really enjoyed getting to know you, and hopefully you've enjoyed getting to know a little bit more about our department. Over lunch, we have a video that we've prepared for you to explain a little bit more specifically about each of our divisions and how you'll interact with them as a resident. We hope you'll enjoy the lunch. Best of luck for the rest of your interview season. And certainly if you have any questions at the end of the day or at the end of interview season, don't hesitate to contact me. Thanks.
I am Cameron Chrisman Robbins. I am a general OBGYN at Washington University School of Medicine, and I have been here 6 years. I absolutely love it, and I'm so excited to tell you about my group and a little bit about St. Louis. So we have 7 OBGYN generalists who take care of patients both in the resident setting as well as a little bit of almost a private practice setting. So hopefully if you come visit us, if you enjoy us and end up staying with us, you'll both see patients with us in a more traditional private practice OBGYN space as well as the resident clinic. So we have also 2 nurse practitioners who take care of patients. Our volume is going through the roof because our new hospital is gorgeous. I tell people it looks like the Four Seasons, which not quite, to be honest, but that's okay. It's gorgeous. Beautiful original artwork by St. Louis artists, beautiful lighting, private rooms. It's quite a lovely place to have a baby. We have really, really good relationships with oncology, family planning, minimally invasive surgery, urogynecology. We stay busy. We curbside each other all the time. Hopefully during your interview time, you will see that genuinely we like each other. I mean, it's not fake. If you come back on a day that's not an interview day, you'll see that we genuinely like each other. Our offices are all on 2 floors. We're all mixed together. We're not sort of cordoned off in little division clusters where we don't interact a lot. We go to the same coffee makers, and we have a lot of fun, and we take care of really sick patients. So that's one thing that you're going to hear a lot on the interview trail. Our patients are interesting, and no, ours are the best. They're the nicest and the most interesting and the most, clinically tricky. So we have a lot of stuff that maybe you'll never see again once you leave St. Louis, or if you stay in a bigger city with a lot of variety, this may be the reason you do that, is because you've loved the variety of pathology that you're going to see here. I haven't done a surgery in 6.5 years without a resident on the other side of the table from me. So you will, when you work with the generalists, operate as I would with a partner. I'm operating with the residents hands-on, and if it's a resident case and it's clinically appropriate, I'm scrubbed and ready, but I'm to the side of the table watching. I'm not, I'm letting the chief teach the junior level resident, and it's their case. A lot of hands-on, really interesting cases come through the doors here. St. Louis is the secret hidden gem of the United States. Don't tell too many people, except for I'm telling you. I grew up in Michigan. I love the Midwest. I love Four Seasons. I love how nice people are. It is an outdoors kind of place. Most people run, bike, or walk in Forest Park, Tower Grove Park. We are 30 minutes away from a state park called Castlewood that is gorgeous. We're an active city and we love food. You will never be bored trying to find a good restaurant to eat in St. Louis.
Welcome to St. Louis and Washington University. I hope each of you have had a good tour and visit of our program today. My name is Scott Beast. I'm the Director of Minimally Invasive Gynecologic Surgery here. Our division is an ever-growing division in which we are rapidly expanding the amount of surgery that we have. Currently, we do more than 500 major laparoscopic surgeries, most of which are all benign in nature. The predominant pathology is uterine fibroids and the associated problems, including bleeding and pelvic pressure and discomfort with markedly enlarged uteri. We are one of the leaders in contained morcellation in the country. We also do significant endometriosis surgery, which at times we will utilize other surgeons from other disciplines, including colorectal, hepatobiliary, and thoracic surgery to achieve excision of all the endometriosis that is there. I also am the director of surgical skills program here, which has been a growing and ever expanding program that is a 2-year cycle currently that covers most surgical topics. We have a basic kind of what I call boot camp during the summer, in which we will cover pelvic anatomy, electrosurgery, basic laparoscopy, and abdominal surgery. And then during the course of the year, we'll cover other topics that can vary from hysteroscopy to complications to vaginal surgery or vaginal hysterectomy. Robotic surgery as well is covered over the 2-year cycle. We have also recently added obstetrics to the surgical skills program, which can include obstetrical hemorrhage and surgeries that are needed for that, as well as simulation for forceps or assisted vaginal deliveries. We also currently have a cadaver lab every year to reinforce the anatomy, as well as a pig lab in the spring. And finally, we also do FLS training with the residents, which they will then have a test or a final exam, which is written, as well as a skills test as well every year. This is important since there's a new requirement starting in a couple years that you will need to pass FLS. So we've had a jump on this, that we've been doing this for the last 8 years now.
Hi, my name is Andrea Hageman. I'm one of the GYN Oncology faculty members here, one of the attendings, and we are very excited to welcome you to the interview day. We hope that you will get a good overview of our division as you're having your interviews today, but I wanted to tell you a little more about the division of GYN Oncology. We have 8 attendings, and we have 4 clinical fellows at a time rotating through our service. When you're on our service, there are 5 residents at a time, 1 intern, a second year, 2 third years, and a chief. We also have 2 nurse practitioners who are on the floor, fantastic nurses, and a really busy clinical service. We think that we can offer a variety of surgical techniques as you go through your residency training, and it's one of the rotations where we really get to see your surgical skills develop from your intern year all the way to your chief year. Not only surgical skills, but also your care of complex patients. We're taking care of a lot of the medical oncologic problems as well when they come to our service. So we can offer you a very strong training in both complicated medical issues as well as complex surgery.
Hello, I'm Jerry Lauder. I'm the Division Director for Female Pelvic Medicine and Reconstructive Surgery here at Washington University. I welcome you to your residency interview and hope that during the course of this visit in the future I get to meet and interact with you. Within our division we have 3 female pelvic medicine and reconstructive surgeons that are all fellowship trained and either board certified or board eligible. We also host ACGME approved female pelvic medicine and reconstructive surgery fellowship and currently have 2 fellows per 3-year cycle. Our providers are well versed in all surgical treatment options for pelvic floor disorders, including vaginal surgery, open abdominal surgery, laparoscopic and robotic surgery. Washington University is a very collaborative environment, and we have significant clinical and research collaborations with many other divisions and departments. We work closely with the pelvic floor physical therapy group, both clinically and on multiple research projects. OB/GYN residents work with the urogynecology division during their 2nd and 3rd years. During their 2nd year, it's part of their ambulatory outpatient rotation, and during their 3rd year, it's on the inpatient service.
I'm Holly Hefkin. I'm one of the gynecologists in the Division of Pediatric, Adolescent, and Young Adult Gynecology. We're a specialty that many people may not initially be familiar with, but we see patients from birth through adolescence up until their young adult years. And we fill a gap in medicine because many of the pediatricians are not familiar or as comfortable with gynecologic and women's health, whereas many adult providers are not as comfortable seeing the younger patients. So we see many of our younger toddler age patients for problems with vulvar dystrophies or labial adhesions. Many of our adolescent patients we're following for problems with their menstrual cycles or pubertal health. and then moving into our older adolescents and young adult patients for typical concerns with contraception, sexual health, and menstrual irregularities. Some of the kind of more interesting things that we may see are patients with congenital anomalies to do with their Müllerian anatomy, as well as ovarian masses and torsions, and patients with gender dysphoria who need gynecologic care. Another interesting aspect of our field is the growing field of oncofertility. So we are seeing patients who are at risk for future infertility or risk of ovarian failure due to cancer and cancer treatments or bone marrow transplants, or really any other sort of treatment that puts their ovaries at risk for damage. And so in these patients, we're seeing patients prior to their treatments, as well as following throughout their treatments and into their survivorship, just making sure that they are aware of these risks and then giving them options for fertility preservation when that's available. And then also following cancer survivors for those late effects of, that can affect their gynecologic health in the future. So a lot of interesting aspects to our field that I think is variable and gives you a large variety of patients, from those younger patients that are, kind of can be a challenge but also very fun, up into the younger adults that I think are more common and something that most residents may be more comfortable with in general.
The Division of Family Planning at the Washington University Department of OBGYN has been really an important part of the experience for our residents over the last 10 years that I've been here. Not only do you get really excellent training with regards to contraceptive services and complex contraceptive care, but in addition, comprehensive abortion care training. We provide our abortion care here in the hospital, on the labor and delivery unit in the second trimester, and in the main OR in the first trimester. And we have off-site training both at Planned Parenthood and the Hope Clinic for Women in Granite City, Illinois. I think the level of support that this institution has for abortion care and complex contraceptive care and family planning training is not only evidenced by the fact that we've had a family planning fellowship for over 10 years, but that we've been a Ryan residency program training site for that period of time as well. Despite the challenges of providing abortion care here in Missouri, we've had a never-ending level of support from both the hospital and the medical school in order to make sure that not only can we provide that care, but that we can ensure that our residents get trained to adequately provide that care. The Division of Family Planning is also one of the areas that allows for opportunities for patient advocacy. Sometimes that advocacy is here within the institution and making sure your patients get what they need, but a lot of times that's advocacy at the state level, where you can come with me or my colleagues to the state legislature to lobby for bills that might support access to reproductive and sexual health care services, and unfortunately too often lobby against bills that are trying to limit access to care. Your voice as residents in the state legislature is extremely important in representing both yourself and your patients when it comes to their need to access this kind of care. Your ability to provide care here in Missouri and in our neighboring state in Illinois is one that you will appreciate on a daily basis. There are many places around the country where abortion and family planning services is not as controversial as it is here. However, despite that controversy, there is a commitment to making sure that our patients have the care they need and that our residents have opportunities to feel comfortable with providing that care.
Hello, welcome to your interview day. My name is Jeannie Kelly. I am one of the faculty here for maternal fetal medicine. Our division is large. We have 13 faculty, 3 laborists, and 7 fellows. We're a large tertiary care center in the Midwest, and I think we really have a unique patient population here. We take care of the St. Louis City urban population, but we also have a very large catchment area in the Midwest, so we see a lot of rural patients as well. We additionally see the high-risk patients from WashU. So these are women who are part of the congenital heart programs, part of the genetic specialty clinics here, and part of the cystic fibrosis clinics here. When they become pregnant, they become our patient. Because of all of these patients, we really have a full exposure to the breadth and depth of maternal fetal medicine at this hospital. I think maternal fetal medicine at WashU is pretty unique in that we really work intimately with the residents. We are one of the only divisions who still take in-house call with the residents on labor and delivery. In addition to that, we just started a third new clinic, and this is something quite special. We take care of pregnant moms who have opioid use disorder. So we specifically see them to take care of their pregnancies, but we also write them for prescriptions for buprenorphine and provide them with behavioral therapy and psychiatric care. As we know, this is a really huge problem that's expanding in the United States right now, and our residents are getting firsthand exposure to how to take care of these patients. Furthermore, you guys are also with us in the ultrasound unit, where you are learning to perform and interpret GYN ultrasounds and some basic obstetrical ultrasounds as well. The ultrasound experience that you get as a resident here is top-notch. You will feel comfortable walking into an emergency room and performing your own ultrasound to diagnose an ectopic pregnancy when you graduate. You will feel comfortable walking onto a labor and delivery and performing your own growth ultrasounds on your pregnant patients when you graduate from this program.
Welcome to the Reproductive Endocrinology and Infertility Division. Our offices are located separately from most of the rest of the department, often referred to as 4444. We have 6 faculty members as well as our IVF lab director and 3 fellows. As a second-year resident, you will spend 5 to 6 weeks on our service. During that time, you will see patients in the office with issues ranging from infertility, endocrinology, disorders, as well as fertility preservation. There's also the opportunity to do mini surgical cases. We typically operate on Fridays, and these cases are done with the resident and the fellow. We have a busy IVF service where we do about 800 cycles per year. The residents have the opportunity to see oocyte retrievals, embryo transfers, and spend time in the IVF lab. We have several ongoing research projects and are always welcome residents to participate in any of these if they're interested. Several of our faculty are also involved in many national organizations such as ABOG, the American Board of Obstetrics and Gynecology, and ASRM, the American Society for Reproductive Medicine. I completed my fellowship training in REI here at WashU and recently returned as a faculty member. I love working with my colleagues and participating in such great care that we offer to our patients. We have some of the highest success rates in IVF in the state, which reflects our excellent care that we provide to these patients. The residents get the opportunity to understand what goes into IVF, and even if you're not interested in pursuing REI in the future, you'll have a very good understanding of infertility and how you can help your patients who do eventually may need these services.
Hi, I'm Shelby Dickinson. I'm the Associate Residency Program Director. Dr. Strand and I would like to thank you for coming to visit us here at Washington University in St. Louis. We hope that you've gotten a glimpse of our residency program, met with residents, fellows, and faculty, and gotten a taste of St. Louis. Feel free to contact us with any questions. Enjoy the rest of your day and have a wonderful interview season.